I'm Dr. Joseph Naim. I'm a bariatric surgeon. I'm a board certified fellowship trained surgeon. My specialty is weight loss surgery. Actually, all of my practice is dedicated to weight loss surgery. The reason is that there's an epidemic of obesity in America, and fortunately we have multiple options that we can provide the patients with in terms of surgical weight loss. Basically, there are two different bands, two different companies, but they do the same thing. I would tell to most of my patients that the risk and complication are the same, but they are welcome to go online and do research, but it's basically the same kind of system for weight loss. As you can see, the adjustable gastric system, which comes in two different packages. One is the lap band and one is the realized band. It's basically a silastic ring that gets placed on the upper part of the stomach. This band helps the patient control his appetite or her appetite and also reduce the amount of food that they can eat in every setting. The system has a tube which is connected to the reservoir, which gets placed under the skin. So nothing is visible. The difference here versus stomach stapling procedure is that we can adjust the size of this band by injecting some fluid in that chamber. Basically, there's saline that gets injected, and you can see the size of the band gets smaller gradually. And by this adjustment, we can control the weight loss. Just like we can make the band tighter if the patient is losing too much weight, not happy, we can make the band looser. There's a new procedure that we've been providing through my program within the last couple of years, and that's called a sleeve gastrectomy. One of the reasons that I'm a fan of this procedure is that the weight loss is superior to the lap band procedure, but I like to emphasize that this is more invasive procedure in the term that, as you can see in this picture, it involves stapling of the stomach. Not only we have to staple the stomach, about 80% of the stomach gets removed from the body. So this operation obviously is irreversible, but has a great results. There's no need for adjustment, and also unlike the gastric bypass procedures, there is no dumping syndrome, there is no malabsorption, and very uncommon for anybody to get into vitamin deficiency from this operation. So I like to recommend this operation to any of my patients who come to my office, and after talking about risk and benefits, usually they decide if they want to proceed with a sleeve gastrectomy or the band or the bypass. So in my program, I offer all of these, and we can tailor the patient to any of these procedures that we think they can have the best results. Sleeve gastrectomy and the band procedure, just like lap band or the realized band, these are considered restrictive operations, meaning that basically the procedure creates a smaller stomach and just reduces the amount of calorie the patient can get. Malabsorptive operation like the biliopancreatic diversion that some people may be familiar with, or gastric bypass, involves bypassing a segment of the small intestine. Therefore, less of what the patient eats gets absorbed. Therefore, you have a possibility of vitamin deficiency. Iron deficiency is common on people who take gastric bypass procedure. And in these operations, important for the patient to be on multivitamins. Not as much on the restrictive operation, not as much on the band operation, not as important for the sleeve gastrectomy. And it's important in the sleeve gastrectomy to mention that not only the patient has less space to eat, also because the stomach is removed, we know that the ghrelin hormone, which is also known as the hunger hormone, is markedly reduced. So there's a second effect from this operation, that my patients are just not hungry. And that's why I think we have superior results compared to other banding procedures. I like to emphasize that also I have a lot of experience with these. Not every program offers the sleeve gastrectomy. Because I work closely with the hospitals like Tri-City Hospital and Cedars-Sinai, we've been able to do close to 100 of these operations, and we had great results. The banding operations these days are done as an outpatient. So we have surgical centers or the hospitals that we can do the operation in, and most patients go home the same day. Obviously, the hospital has more equipment, more facilities, and if there is a need for overnight stay, it's already there. In terms of the stapling operation, like the sleeve gastrectomy or gastric bypass, they're always done in the hospital facility because they require 1 to 2 nights hospital stay. I only work with the hospitals that are known as the Center of Excellence. We have Tri-City Hospital, which is known as a Center of Excellence. What that means is that the hospital has shown to have a high volume with a very good results. Therefore, not only I have a lot of experience, the anesthesiologist has experience, the nurses have experience, the radiologists have experience. We have a whole system, whole areas of different specialties like psychologists, dietitian, cardiologists, pulmonologists, endocrinologists, available in the hospital every day. They can come and visit the patient as needed. That's important because most patients that have morbid obesity, not only they have a struggle with the weight, they also have multiple medical problems like diabetes, like high blood pressure, like sleep apnea. So they are a little bit high risk compared to healthy people. So we like to cover all the aspects to make sure that everybody goes through the procedure safely and everybody goes back to their family the same night or after 1 to 2 nights, and they enjoy the rest of the life with the family, with the kids. Patients who go under sleeve gastrectomy require a 1-night hospital stay at least. So after the 1 night, they will go home, and the recovery is about 3 to 5 days. All the operations that I perform are done laparoscopically through the keyhole incisions. Therefore, the pain is very minimal. Most of these procedures have about 3 to 5 days recovery. The band operation, because there is no stapling, patients go home the same day. And they can be back to work, let's say in a matter of 3 to 4 days, they can be back to work. In terms of the diet, all these procedures, because there's some change in anatomy of the stomach, I would recommend all my patients to be on liquid diet for 2 weeks. So 2 weeks of liquid followed by 2 weeks of puree. After about 4 weeks, they're used to the new stomach and they can start eating solids. They always have to chew the food well. They have to understand that they're not to drink and eat at the same time because that may cause some irritation and what will not help them to lose weight. So we have instructions, written instructions. We have program coordinators, office managers, PAs and nurses that are there to answer all the questions. I'm always available in terms of any medical questions, and this way we will not only do the procedure, we will help them through the process after surgery so they can get the best results.